वेलकम टू दिस चैनल। मैं सेल्फ डॉक्टर टी देवनाथ। आज इस वीडियो में हम लोग बात करेंगे न्यूरोबायोलॉजी ऑफ मूड डिसऑर्डर। इट इज वेरी इंपॉर्टेंट टॉपिक फॉर द सेक्रेटरी। न्यूरोबायोलॉजी दैट वी नो द मूड डिसऑर्डर इज बिकॉज ऑफ द neurotransmitters, that is dysfunctional neurotransmission is one of the important hypothesis for this mood disorder. So what are those monoamine neurotransmitters? These are very important. These are three: is the norepinephrine, dopamine and serotonin. Norepinephrine, dopamine and serotonin, plus it is glutamate and GABA. Now before going to the monoamine hypothesis of the depression, rather I will talk about the importance mechanism or the manufacture or their elimination from the body of this all neurotransmitter. In this video I will talk about the formation and metabolism of the neurotransmitter, that is norepinephrine. Now norepinephrine, the precursor is the tyrosine. Remember, tyrosine comes from the food. Okay, food, it will go into the blood. Now from the blood it has to pass into the CNS. This has to pass into CNS through transporter. We call it norepinephrine transporter. Now once it is in the CNS, now it will, as I told you, the tyrosine is the precursor of the formation of the norepinephrine. Now what are the steps? There are three important steps. Remember, the tyrosine convert to dopa by the help of TOH, that is tyrosine hydroxylase enzyme. Remember, this is the rate limiting enzyme of this tyrosine metabolism. Okay, now dopa is converted into dopamine by the DDC, is the dopamine decarboxylase enzyme, and then dopamine actually itself a neurotransmitter, and it convert, and it is the precursor for the norepinephrine. So dopamine convert into norepinephrine by the dopa beta hydroxylase enzyme. Dopamine convert into norepinephrine by dopa beta hydroxylase enzyme. So these are the three important enzymes you need to remember, and I will talk about how this norepinephrine acts on presynaptic receptor and postsynaptic receptor. Now whatever norepinephrine has produced, it will be stored in the presynaptic level. Okay, in the presynaptic vesicle, we call it synaptic vesicle, it will be stored. But who will help in storing? That is BMAT2. BMAT2 will help in packaging of the norepinephrine in the synaptic vesicle. Now once there is a nerve impulse will come, no, that norepinephrine comes to the synaptic cleft. Now the norepinephrine has two important pathways. Number one, it will go into it will damage by the COMT pathway. COMT, catechol O methyl transferase pathway, the norepinephrine will damage, or that norepinephrine will go into the presynaptic vesicle. How? By the transporter. Norepinephrine transporter will go into this synaptic vesicle. Okay, now it may store into the synaptic vesicle again, and when there will be re-impulse or another impulse will come, then there will be norepinephrine released to the synaptic cleft. But remember one thing, the norepinephrine can be damaged by the COMT pathway or can be by the damaged by the MAO-A, MAO-B pathway. Okay, these are the two important pathway through which norepinephrine metabolism will occur. Number one, it will come when there is impulse, norepinephrine will release into the synaptic cleft. Now in the synaptic cleft there is a COMT, catechol O methyl transferase, it will damage the norepinephrine, or that some of the norepinephrine go into the storage form for reuse, and some of the norepinephrine will be damaged by the MAO-A or MAO-B. This is the life cycle of the norepinephrine. Now see what will happen. This norepinephrine is the presynaptic vesicle. Okay, impulse happens, so there will be release of the norepinephrine into the synaptic cleft. This is the synaptic cleft. Okay, now it has to work on the receptor. So what are the important receptor you need to know? It is very important. We have alpha 1 receptor, we have alpha 1 receptor, we have alpha 2 receptor, we have alpha 2A, 2B and 2C receptor, as well as beta 1, beta 2 and beta 3 receptor. Okay, and out of these two, out of these all the receptors, remember alpha 2, it's a presynaptic receptor. Alpha 2 is a presynaptic receptor, so we call it as O2 receptor. O2 receptor, because it will be important for regulation of the norepinephrine release. Now that norepinephrine, it will bind, some of the bind will be the O2 receptor and it will go into the storage again, and other part of the norepinephrine will be added to the receptors, to the all the receptors, and it will show its function. And some of the norepinephrine will transporter, it will go into the synaptic vesicle again. Okay, so this is the pathway, this is the metabolism, and this is the fate of the norepinephrine. Now in the next video I'll talk about other neurotransmitters, and later on we'll talk about how these act as how the monoamine hypothesis for depression happens, and how whenever we give some medication, how they act, where they act, that will be discussed in the further videos. I hope this video has given you some idea of the norepinephrine metabolism, and most of the things actually we have studied in our UG undergraduate, as well as when you are preparing for the NEET PG. This is one of the important metabolism we have to remember. So definitely it is a very important. I hope you are getting some benefit of this video. Thank you so much.